We're going to move on now to Dr. Lee Merritt, who also has her own military background. And I've had her on the Dr. Jane Ruby show a number of times. She's always a crowd favorite. We get so much interest and engagement in her work, her perspective, the receipts that she brings. I believe she is up and ready to go. If we want to bring her up to the screen now.
All right.
Dr. Lee Merritt.
Well, thank you so much for having me on. I'm really honored to be here. And, I'm a recovering but classically trained physician. So there's a dictum in medicine that it's one thing if you miss making a diagnosis with some untreatable disease. You haven't really cost anything. But if you miss a treatable disease, that's really an unforgivable sin. So what I'm going to talk about today is vaccines and parasites, because I want to focus on something that I think is very treatable and that we're not doing. So, the bottom line here, and you've heard it from everyone else, that there's really no ingredient list. We're still kind of groping in the dark. We've seen the metal fragments. The basic science researchers admit there's graphene oxide layers in here and the lipid nanoparticle along with cationic lipids. So this really isn't debatable at this point. But what else is in here? Nobody really knows. I can tell you just the graphene oxide and the cationic lipids can explain some of the clotting that we're seeing, but not all of it. And so the bleeding and clotting, I'm not really going to talk about. What I really want to concentrate on the non-clot related COVID vaccine symptoms. And what we're told is that 30% of the batches, this is work from Craig Particooper about how bad is my batch type thing, 30% of the batches have no reported side effects. So they're assuming that those batches are placebos, and that may be true. The people that are having symptoms, here's some of the things we see. We see fever and malaise, so they can have, like flu-like symptoms after they take the shot, redness and swelling at the entry site, lymphadenopathy. This is why women cannot have mammograms right after they have the COVID vaccine, because it looks like they have cancer because they have all these swollen lymph nodes. And then you heard earlier about first-degree AV block. It's cardiovascular conduction problem, and it used to be non-qualifying for military service and certainly disqualifying to be a commercial or military pilot on active flight status. However, now it's okay. We've just redefined what's the requirements because so many people have first-degree AV block now. Myocarditis is what you hear about, and sudden cardiac death, and then meningoencephalitis is an inflammation of the brain. But where else do we see things like this? Well, here's acute to chronic phase Chagas disease. Now, Chagas disease is a parasite. It's endemic in South America. We know it's been coming across our southern border for years. And this is the picture of the little seahorse-looking guy there in the middle of the red blood cells of the parasite, the Trypanosoma cruzi. And what are the symptoms of Chagas disease? Well, interestingly, 30% of people that acquire the parasite are asymptomatic. And when they're not, they get fever and malaise, a flu-like symptom, redness and swelling at the entry site, lymphadenopathy, first-degree AV block, myocarditis, sudden cardiac death, and meningoencephalitis. What does that sound like? It sounds exactly like what we just heard, the symptoms we can see in people with the shot, okay? Now, some other facts and evidence is the fact that parasite eggs cannot be killed in the process of these vaccines and similar bioactive vaccines, because parasite eggs, as you'll see in one of these slides, they're very resistant to heat. So even desiccating a slide doesn't kill them. Parasite eggs cannot be killed without killing the biologics in the vaccine. So they could be in there. We also have a history of bioweaponized mycoplasma. We know about that. Came from China to Hong Kong to Fort Detrick to the AFIP and somehow got into military vaccines in the past. So we have some history of this. And I won't go into 3 and 4 here, but Feng Zhang was the head of the Zhang lab at MIT. And, when you talk about CRISPR and all these things that we're hypothesizing about what's in these vaccines and all this complicated genetic stuff, it's really kind of interesting that here's the father of CRISPR who says, we can't really do that precise gene insertion, but we can do gene knockdown. Now, gene knockdown is the kind of thing that would take away a function that could allow, for example, parasites to then break out and become active in the body. Now, why in this is the thing that woke me up kind of, why in 2020, and this is from talking to people like Colonel Long and others that have been dealing with this problem, is we have to ask, why in 2021 did cancer change its spots, kind of like a leopard, right? Because suddenly we're seeing this turbo cancer. People that are well, they're in remission with their cancer. They get the shot and suddenly they decompensate, and they have not just one recurrence, they have metastases all over the place. Similarly, young men are showing up in the military with not just one tumor. I mean, when I was in, we used to see the guy with the isolated testicular tumor, for example. That's not uncommon in young men. But it's one thing. You send them to the urologist and take it out, cured, whatever. Now you're seeing them show up like dead men walking with these so-called metastases all over them. Now, why could that happen? Well, it turns out everything cancer likes, parasites like. Doctors all over the world now are starting to report that 100%, not a few, but 100% of cancer patients, when you look at their live blood, like we heard Dr. Mahaj just say, doctors are starting to look at live blood again. And they're seeing parasites in all of their cancer patients. They're floating around in the blood. It would explain, parasites would explain cancer and trauma because if it's in your blood and then you bang yourself and you bleed into the tissues, well, suddenly you've got these parasites in a place where your immune system might not be able to get at them quite as well, and they start growing a mass, and we call that a tumor. And then we get more masses, it's metastasis. Why the military? These are guys that have been snooping and pooping like these guys in the brush. They've been drinking bad water and eating food contaminated, possibly in third world places, and they've probably got a lot of parasites. And then we give them a vaccine that knocks down their immune system, and these things start coming out. And we see them, unfortunately, parasitologists know this, but oncologists don't talk about it, that under a microscope, egg sacs of parasites look identical in many cases to solid tumors. Now, here's an interesting point. How do cancer cells metastasize? Well, they always thought it was kind of random. These little cells would randomly go out. But it turns out, as they've been studying with more advanced techniques now, they found out that cancer doesn't metastasize at random. It goes to places, these cancer metastases, as they say here, take little steps interspersed with long flights, and they consist in this movement, which they call Levy walks. It's actually what is often, quote, often employed by animal predators searching for scarce prey or food sources. So again, parasites would exhibit this they're moving from where they've consumed the food to someplace else in the body. And you see it and it shows up as a metastasis. Now, if you say, well, Americans, we're in a first world country, we don't have parasites. Here's from Dr. Omar Amin. He's a 30-year parasitologist, probably 35 at this point, and he looked at 66 surface water treatment plants in 14 states, and 27% of American drinking water samples had a parasite, Cryptosporidium parvum. Now, that's just one that he tested for. Okay, so 27% of drinking water may be contaminated with parasites in America. Now, I'm just going to show you this I excerpt this from this video. You can see it. You can go to Google, cancerous parasites, Google it. This is what it looks like, and this is what it's going to tell you. This is about German research that's very convincing from the 1960s to 1980s.
Dr. Alphonse Weber conducted conducted similar experiments since the early 60s. He filmed the experiment in the 60s to 80s and created thereby unique evidence. The microparasites described by Dr. Weber that you can see here can be found in the tissue of all cancer patients.
In the tissue of all cancer patients.
Here you can see a blood sample that has been dried over a flame. The patient suffered from leukemia.
Leukemia, and look at the cell motion. Look at the little motive parasites in the thing.
The blood sample of a patient suffering from liver cancer. Here the blood of a patient with bladder cancer. And this is tissue from the bladder carcinoma. You can clearly see the lively movements of the microbes.
Lively movement.
Here the diagnosis is that of lymph node metastasis. String-shaped structures.
Now look at that, and then ask why the universities are not looking at this.
You can see certain reoccurring types of microbes in all of them. There is no tumor tissue without these microbes.
No tumor tissue without these microbes. I got to say that again.
There is no blood of a cancer patient without those microbes.
And no blood of a cancer patient without these microbes.
That have not yet been acknowledged by mainstream medicine as the cause of cancer have been comprehensively shown by Dr. Weber. They belong to two species. A. String-shaped, grown up. The length is 2 times that of a red blood cell. D. Stick-shaped. This is the most commonly found shape.
So, a slight English error there. They're not two species, but two shapes of parasites. All cancer patients have them. We need to be thinking about this. And again, we're talking about taking medicines that have a very high safety degree. So, very, very low side effects of any of these things. So what do we need to be doing? In my opinion, everybody, not just if you've taken the vaccine, but everybody has parasites. But at least we should realize when somebody comes in with a vaccine, they're in turbo cancer, there's all these things. Let's just not send them home to die. It's worth a trial, in my opinion. If you look at this, and you can look at a lot more information than I just showed you. Ivermectin, fenbendazole.org is an organization that has a whole program that's been underground treating people and saving their lives. Albendazole is now being looked at by the NIH for cancer, nitazoxanide, and then these are other things, obviously. You need to do your parasite protocol with a cycling on and off program, not steady state. You need to think, and you need nutritional support, clean diet, exercise, and a spiritual connection. That's true of anybody with any problems. But I just don't want us to miss this one anymore. And I have a protocol on my site. I'm not saying it's the ultimate. We'll find out the ultimate later. But right now, you can go to themedicalrebel.com and just print it out. And that's my plea, to not just dismiss this. I've been told by big doctors in the freedom movement, don't come back and talk to us about this. This is just crazy, and we don't want to hear it. But I'm going to tell you, we're going to let a lot of people die if we don't pay attention to this, in my opinion. Thank you very much.
Thank you, Dr. Merritt. I find this whole parasite connection really incredibly intriguing, and I'm so glad you're leading the charge. It's really amazing if that's what it is. And of course, it goes back to the allopathic medicine and the Rockefeller men and all that other stuff, criminalizing, non-pharmaceutical approaches. Dr. Bill, before we go to Dr. Ulrey, any last comments on Dr. Merritt's incredible presentation?
Well, I totally support her presentation. And, you have to ask yourself, right? In the early days, right, come back to those, why were they trying to demonize hydroxychloroquine, ivermectin, and anything that might be anti-parasite? Did they know something that we don't? We know that they wanted to demonize things because they wanted other drugs in place, but they also knew, and I believe they knew all along, that there's a parasite component. And why it was so successful with so many practitioners around the country, I believe she's on the right track here. What else would it accomplish? What else would be indicating that other than removing the parasite component that I believe that you're onto?
It's interesting, Dr. Ruby and Weinberger, that when you read researchers at the NIH now doing cancer studies using fenbendazole or ivermectin or whatever, they will come to this conclusion that gosh, this seems to work now, and then they come up with this incredibly convoluted explanation of microtubular disinhibition or whatever, the reason it works. It's kind of like, you count your cow herd by counting their legs and dividing by 4. They just can't bring themselves to think it could be parasites. And I don't think that's by accident. I'll just say there's a show out there. It's a very interesting show. It's called The Silo, about these people that are in the survival thing. But one of the rules of the silo in this futuristic dystopian world is you can only see magnification of a certain amount. If you go over that, it's a death penalty. Now, I want to point that out because we've had the opportunity in this world of having magnification, as Royal Rife built, 15,000 times using quartz optics. And yet we're still lucky to see 2,000, 2,400 magnification. Why do you think that is? This is simple technology. It should be available. In my time, when I was a medical student, they told us to be a good doctor, you had to look at everybody's blood and everybody's urine. But now they never do that. Right after I got out of medical school in 1980, it stopped. They said, oh, no, don't look at that. Just send it to the lab. And why are they not catching all these live things? This is really shocking to me.
Yeah. Well, that's what we need to find out, and that's what one of the gifts of the COVID scam has brought us, is all this revelation. So thank you so much for that, Dr. Merritt. Great stuff. Wonderful.
Great.
Thank you, Bill. Dr. Bill, we're going to move now